My name is Dr. Dana Hardy. I'm the owner and operator at Generations Family Dental here in St. Albert. I've been practicing since 2006 here at this office for 8 years. I became a dentist because I started as a dental assistant and I felt like I wanted to do more, but loved the field of dentistry. I love teeth. So instead of staying as an assistant, I went to dental school and became a dentist. About what I like about practicing dentistry, one time when I was interviewing for my faculty position, the dentist interviewing me asked what my favorite procedure was, and that was over 10 years ago, and I've always circled back in my mind to what I love about being a dentist. Do I love doing extractions or root canals? But I really love the patient interaction. That's my favorite thing about being a dentist. Not a procedure, but interacting with patients. And maybe taking a patient from being very nervous to just being really relaxed and almost having fun at the dentist. My vision for this practice was that we could treat people better, we could maintain an excellent standard of care with the latest technology and still do well in terms of a practice. I wanted to be very minimalistic, comprehensive in regards to how I approached patient care. And as an associate, I just didn't feel like I was able to do that. I decided to integrate Aevo because I wanted to be on the leading edge of technology. St. Albert's a very competitive market for dentists. There's a lot of great dentists in the community. So I needed things that would set myself apart. So that was my leading motivation. I felt like Aevo was the leading technology in terms of accelerators. It would set me apart from the rest of the community in St. Albert. I really believe in the technology. I would not be putting my patients potentially at risk by trying to move teeth that were maybe periodontally involved or maybe a more complicated movement. I just felt more comfortable doing that safely with the Aevo. My goals are to achieve a great result in terms of aesthetic and occlusion safely, quickly, and predictably, and then have predictable long-term results. No, patients like the benefit of moving through their treatment quicker. In general, there's less refinements with the Aevo. Yeah, the appointments are fewer. When they are here, it's a lot quicker because everything's tracking as planned. They don't need to have another scan, wait for refinement, so things are moving a lot quicker for these patients. The main practice benefit is that we're seeing patients less. Their treatment's moving more predictable, so that helps me in terms of less appointments, less revisiting this case. But it also helps me because the patients are very happy with their treatment, and from a PR sort of standpoint, they're telling their friends, they're really excited, things are going as they thought and as planned, because when you're revisiting things and doing refinements, patients think that there's something wrong, that they've done something wrong. So if things are moving as planned, they're much happier. And they have more confidence in us as providers because we've accomplished what we told them we would. Aevo is very helpful in terms of the technology, moving the teeth, the safety factor. It's also very helpful for us to check on compliance for patients, because if they're compliant with the Aevo, we can hopefully assume they're compliant with their treatment and their Invisalign. I think that if you want to use an acceleration device, the literature is this is the only device that's supported. So every time we have a patient in for an aligner check that's using Aevo, we check their compliance on the website. If they have a change in their compliance with the Aevo, we can ask them what happened if they had a change in their compliance with their Invisalign, with their treatment. And oftentimes there is a correlation between that. Maybe they've gone on vacation or something happened that they weren't wearing their aligners, and then we can sort of redirect them, remotivate them, talk to them about that. As we have integrated it into everyone's treatment, So everyone has an increased fee that accommodates the Aevo. And then we can sort of dictate, not based on fee structure, but on necessity. Do we think they need the Aevo to accomplish what we've planned, or to do it quickly? Our patients with Aevo, when we do their 6-month check, their retainer check, we've noticed a lot less relapse with them as opposed to patients who did not use the Aevo. Is prompting me now to add the Aevo to everyone's treatment. I have a patient who, and this is what the first patient I used the Aevo on, she had class 4 perio of her lower incisors. They were very crowded. She was having a really hard time cleaning them. We were having a hard time cleaning them. She really wanted to do Invisalign to resolve her crowding. So that was the first patient I used the Aevo on. Her treatment moved beautifully. Her perio, she's now has no periodontal disease in those teeth. We were very on top of it. We were cleaning them every like 2 months, but the fact that these class 4 perio involved teeth moved so beautifully and are now healthier than ever is really, really fantastic. So yeah, we know that patient, she was so happy, and now she'll be healthy for the rest of her life with those teeth. So. Yeah. Whereas before I would never have even, before Aevo, I would never have even considered touching those teeth orthodontically.